This week, 2 Senate committees will hold confirmation hearings for Robert Kennedy Jr., President Trump's nominee to be Secretary for Health and Human Services. Every day, HHS, this major government agency, makes life or death decisions. That agency oversees the Food and Drug Administration to make sure that what we eat is safe, to make sure the drugs that are sold to us are effective and safe as well. The National Institutes of Health is in this agency. It is the premier medical research agency in the world. In the world. Some $40 billion spent each year to find cures, to find new drugs, to move us toward a better America. And the Centers for Disease Control and Prevention. Their job is not as flashy as some, but it's so important. What they do is to make sure that whatever is going around, as they say, doesn't hit our families. We count on them every single day. It's a big job. It requires responsible leadership and honesty to be overseeing an agency that has these critical agencies of government. Now, there may be some certain areas where we agree, such as curbing drug ads or improving the quality of the food supply. And I know Robert Kennedy Jr., and I've worked with him in the past. I can work with him on those issues. But on the fundamentals, the basic question of his leadership is troublesome. Robert F. Kennedy Jr. is dangerously unqualified and entirely irresponsible in his judgment. He embraces quack science and cherry picks information to fulfill his numerous conspiracy theories. His decades-long crusade to spread lies about vaccines is just one example. Let me show you a chart that is pretty explicit, pretty short. Robert Kennedy Jr. There is no vaccine that is safe and effective. This man who wants to head the agency which develops vaccines and monitors their use said there's not a single vaccine that is safe and effective. He has stated that as recently as July of 2023. Contrary to scientific fact, he has also said that, quote, I do believe that autism does come from vaccines. I've heard this theory and I think about it so many times when I think of my friends and families who are raising autistic children. What a burden, what a responsibility, what an effort they have to put into it to give these young children a chance. And to have this quack theory out there that this has something, their child's problems has something to do with vaccines is cruel. And an outlandish conspiracy manifesto, which he's helped to publish and wrote the foreword for, entitled Cause Unknown. Here's the book. It attempted to link COVID-19 vaccination and deaths in young kids. I'm going to put this up here. It's a picture of the cover of this book with a foreword written by Robert F. Kennedy Jr., who's up for approval as part of the Trump cabinet, head of the HHS. The book's cover has a picture of a young man whose name is Braden Fahey. The only problem, this book, which is called Cause Unknown, The Epidemic of Sudden Deaths, and talks about COVID vaccine, Braden never received a COVID vaccine. This poor little boy died at a football practice due to a malformed blood vessel in his brain. And the book included his photo without the knowledge or consent of his parents, the height of irresponsibility. Mr. Kennedy pushes facts aside when he wants to tell us about his agenda. The Hippocratic Oath for doctors states, first do no harm. But I am fearful that if we put Robert F. Kennedy Jr. in charge of our nation's health, innocent children will die. It's no secret what he would do. Mr. Kennedy himself petitioned the FDA to rescind authorization of all COVID vaccines in 2021. And a key associate of his is petitioned to remove the polio vaccine. Look over here to the pages we have in the Senate. I think of my own experience when I was 4 or 5 years younger than them. It was in the 1950s We knew polio because we saw kids in our classrooms who were here today and in the hospital tomorrow. They contracted polio. It could be deadly. It could be crippling. It could affect you for the rest of your life. We knew this thing called an iron lung. It looked like a big vat, a big white vat, and the head sticking out at the end of it was this young person who had contracted polio. This iron lung was helping these young kids to breathe and stay alive. We lived in dread of the possibility of coming down with polio. I remember talking about it when I was a little kid. How do you get polio? Nobody knew. And then the day came when Jonas Salk, Dr. Jonas Salk, developed a vaccine that was going to protect us from coming down with polio. Later on, Dr. Sabin developed an oral version of the vaccine, which we kids like a lot more. But the bottom line was, in my lifetime, in my childhood, we stopped polio in the United States. It was a vaccine that worked over and over and over again and millions of times over again. It worked. In 1952, polio paralyzed more than 21,000 Americans and killed more than 3,000. But thanks to researcher Jonas Salk, the vaccine discovered and studied among 1.3 million children. They did testing of thousands of kids across the United States before they injected all of us, and it was proven safe. The last case of wild polio found in the United States was 1979. That's over 40 years ago. Robert F. Kennedy Jr. has spread conspiracy theories to discourage uptake of the measles vaccine, for example, including traveling to Samoa to spread lies about its safety, fueling an outbreak that took 80 lives in Samoa. Before the measles vaccine, 48,000 people were hospitalized each year in the United States, with thousands experiencing life-threatening brain swelling. By 2000, measles was officially declared eliminated because of vaccines. Mr. Kennedy's dangerous anti-science views don't stop with these obvious plus vaccines that have helped America. He has also targeted the fluoride in drinking water. We have been adding tiny bits of fluoride in our drinking water for over 70 years in the United States. We have tested it every way you can imagine, as we should, to make sure that it is safe for all of us to drink. And the tests come back suggesting it has always proven its safety. Why do we do it? It reduces cavities in teeth dramatically. And a little bit of fluoride can go a long way in that regard. I will tell you, it has changed dentistry since I was a kid. Going to the dentist used to be a not very welcome adventure, and kids went regularly with cavities galore. I was one of them. But the fluoride in water has changed things for my own children and grandchildren. It's safe and it helps. But Robert F. Kennedy Jr. doesn't accept that. He wants to contest fluoride in drinking water. This man is not a scientist. He's a political figure, and I've known him for many years. He has no special knowledge or authority when it comes to these issues, and sadly buys into a myriad of conspiracy theories. Let's be clear. There is no evidence that current recommended levels of fluoride cause any harm. On the flip side, it's been established, as I said, for over 7 decades that it helps prevent cavities and dental surgeries in children. God forbid we ever encounter another pandemic or infectious disease threat. Do you really want this vaccine denier, Robert Kennedy Jr., at the helm? I issue a challenge to my 99 Senate colleagues. Go ask your local children's hospital if they think this nominee, Robert F. Kennedy Jr., would help or harm the way they work to treat our children. I know what the answer is going to be. The United States Senate is better than this. I urge my colleagues to think twice for voting for this irresponsible nominee. The impact on the public health of America could be devastating, and we've got to accept the responsibility that this is the wrong nominee for this critical agency. Mr. President, I yield the floor.